This is Morgan Johnson from Evolution Sports. I'm here with Caroline May today. We're bringing you a video that demonstrates how to perform an upslope manipulation for the cervical spine. The upslope manipulations are great for your upper cervical spine levels, C2 through 4. It is a chin cradle manipulation that's using rotation as a primary movement. Make sure before you do any kind of manipulations that A, you have confidence, B, you have the proper training, C, you've gotten all of the special testing done to rule out BBI, alar ligament, etc., 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 cover your behind, and finally, and most importantly, you want to make sure you have your patient's consent to do so. So I've got my patient lying supine, head's off the edge of the table. If you have a drop-down headrest, it's fine to use that as well. You just want to make sure that you've got comfortable movement around the patient. You can keep them in a good position. Always advocate doing your manipulations in a standing position. You get better translation of force, and usually they're more comfortable for your patients. So in this case, I'm going to first palpate using a key grip position with my fingertips where the level of rotation is. I'm using my right hand to do my chin cradle and rotary forces here. So I'm going to set her up here. I'm going to use my left hand to identify where I feel any stiffness. Okay, and then I'm going to use the thrusting knuckle, which is my second metacarpophalangeal joint, is going to be placed on the articular pillar, and that's where I'm going to be adding my tension and eventually doing my thrust rotation. So we're going to start with rotation to the level in question. We're going to add a little bit of extension and side bending to further set up the level. Okay, so again, rotation, extension, side bending, and we're going to end with rotation. Okay, a little audible there. Caroline, you come on up. What I'm going to have her do, we're going to retest range of motion, compare her signs and symptoms to our pre-manipulation, and then we're probably going to follow this up with some cervical stabilization and postural retraining.